Second thing that we are very excited about is the risk adjustment success GPT. And the risk adjustment success GPT is made to make sure, just like your chat GPT, that have done a lot of the legwork based on my experience working at CMS previously. Take many of these resources, clean them up, curated them, standardize the languages so that if you're looking at one resource and it's saying calendar year and another one is saying payment year, and you're new to this, you're like, are they the same? Yeah, Hills Academy has taken care of that for you. So clean them up, put them together, and has added on a large language model that users can easily ask questions. For example, we're talking about payment year. So you can ask, what is the deadline for payment year 2024? And then it will go through the resources, clean them up, and quickly return a response to tell you the deadline for payment year 2024. Instead of searching on Google, very likely you're not going to get an answer from Google. You may go to CSSC website, or even if you're new to this, you don't know where to go. You cannot just ask ChatGPT because it's not going to give you the answer or the correct answer. But that is what Hills Academy does. How do we create simple, usable, and useful resources for audience, either providers, either for health plan, either your billing team, so that it's like a pocket advisor. You can pick it up. You can ask the question on your phone. You may be in your child's graduation and the deadline is looming and the provider or the health plan is saying, we need this data very soon, or a question comes in. You don't have time to go open your laptop, trying to search online and all these things. Pick up your phone, open the Hills Academy app and just ask the question, and it's going to give you the response. And as we are going, we'll be adding in the various references, and we are going through various references so that you are able to give the references of where you got your information from, easily usable and useful. Take and give you your time back. That is what we want. And we want everybody to be masters in this space as well.
Artificial intelligence, AI is here, but a lot of times they're general, right? They have to be trained to do things effectively. But imagine them putting all information about risk adjustment and how it affects you as a provider is basically put in the palm of your hands. And so that's really what this is about. When we talk about AI and artificial intelligence, we utilize AI in some of our patient engagement software as well. But people don't understand it's built on our data sets, which is over, decade of understanding patients and how they communicate with them. You can't just go to a general bot or Google to find this information. This is built on your knowledge. I'm sure, decades in the making, right? To understand this stuff and understand it clearly so you can use it and be informed. And so I think that's what people have to understand. And I think you may be giving us a link to it. So, if you're looking down the description, we'll have a link to go try it out and be on the wait list. But this is something that we think is going to be extremely helpful for providers, anyone just interested in this space, because there's an opportunity if you're looking to grow in understanding risk adjustment.
The fix isn't more automation. It's keeping patients engaged with a human in the loop. That's exactly what we built for. As a matter of fact, that human-to-human connection is so important to us here at SynsorMed that we created a new AI tool called Simon. It's about getting patients engaged in their own care while keeping the human in the loop. A reward-based system that gets them taking their meds, checking their blood pressure, and staying active, all in a point system with leaderboards to keep them excited about their healthcare journey. It really keeps the patient and the human in the middle, but uses AI to track everything and encourage patients along the way. Hey, if you want to see it, if it fits your organization, put the link below, check it out, and give us a call if it makes sense.